Hi, I'm Josh Richards. I'm a hand, elbow, and shoulder surgeon in Oakland, California. Today I'm going to talk to you about what to expect after a scaphoid fracture. The scaphoid is a small carpal bone in your wrist. We consider where the forearm meets these small carpal bones, the wrist area. What's unique about the scaphoid bone is that it has a hard time healing. The blood supply to the scaphoid is not good. So a small, tiny crack or even hairline fracture can become a big problem. Whereas most hairline fractures anywhere else where there's good blood supply, the bone heals fine. So most emergency room doctors, urgent care doctors, primary care doctors have heard of the scaphoid because they're worried in cases that people have one, that they need to see a hand surgeon to talk about the treatment options. So sometimes the x-rays are negative in the first 3 to 4 weeks, which is unusual compared to other fractures. What I mean by that is that you can't see the crack. You're just tender in that area and there's some swelling. There's not always a lot of swelling, and sometimes it doesn't even hurt very much. So it's a common football injury. Kids will come, they'll get hurt halfway through the season, they'll play through the whole thing because it doesn't hurt that much, and then they finally come in and we see that they have been playing on a scaphoid fracture, which is not a great scenario. So it's really important to follow up with a hand surgeon to see if he thinks you might have a scaphoid fracture, which sometimes he'll order further imaging, like an MRI or a CT scan, which will confirm the diagnosis, or he'll treat you like you have one, and typically around 4 weeks, the x-ray will show that the fracture is present. Some people have the patience for that, some people don't. So that's where the MRI or CT scan can come in. Typically, there's 3 different areas of a scaphoid that can be fractured. The mid portion or waist is the most common. That's one that takes about 10 weeks to heal on average, 10 to 12. So it's a long time. That's about double most fractures. It's up to the surgeon and you about how long you'd be in a cast for something like that. If it's non-displaced waist fracture, at least 6 weeks immobilized is important, and oftentimes a lot longer. The way I treat scaphoid fractures may be different than others, but for scaphoid waist fractures that are non-displaced, I cast them for 6 weeks, take the cast off, get films. If the films x-rays show that it's not healing very well, then I'll obtain a CT scan at that point to truly assess how well it's healing. A CT will give me ballpark figure like 50% healed, 70% healed, usually plus or minus 10%. If it looks better than 50% healed, then usually we're going to continue with casting and mobilization. If it's 50% or less, then we're going to be talking about making a very small incision on the back of your wrist, less than a centimeter, and placing a screw down the middle of the bone. What the screw does is it compresses the fracture, which generates better bony healing. So it actually stabilizes that injury and can get it to go on to heal more predictable. Some surgeons might even suggest surgery right away, even in non-displaced fractures, and that's not unreasonable. I don't typically do it that way. As far as if it is displaced, then it needs to be fixed acutely, like right as soon as you can get in and get it fixed. With any fracture, you have a couple weeks to safely fix them, so it's not like something that needs to be done that day. The worst part about scaphoid fractures is when they don't heal or aren't healing. So 3 months out, 4 months out, if this is not healing, whether they had surgery or not, that can be a problem, and it happens. Approximately 10%, 5 to 10%, depending. If that happens, then sometimes you need bigger surgery. The bigger surgery is where we take bone graft from your pelvis, open up your whole wrist, so make a bigger cut, get to where the fracture is, clean out the area of the fracture, place the bone graft from your pelvis, and then put the screw in. That's obviously a bigger operation, and so the idea behind what I described earlier, which is intervening with a small screw at 6 weeks when things don't look good, is to avoid having to make this bigger open operation, taking bone graft from your pelvis. And it typically works really well. Every hand surgeon has different approaches to this. They do different types of operations. When the bone hasn't healed, sometimes we take vascularized grafts, which means we transfer blood vessels with the bone. Not everyone does that, and there's various options for that as well. But overall, the typical fracture is a scaphoid waist fracture. It takes about 10 weeks to heal. If it's not displaced, typically a cast does it. Sometimes you need a screw. Occasionally, other areas are broken. The proximal portion of the scaphoid, which is more towards the forearm, that's the spot that's least likely to heal. So usually we fix those acutely. Just get the screw in, compress it right away. If it's on the far end or distal end towards the thumb, that's the one that's most likely to heal. So typically you don't need surgery for that and heals quicker, like 8 weeks. So again, review: waist fractures, most common, non-displaced, casting, potentially a screw if it's not healing well by 6 weeks. Proximal pole fractures, typically a screw right away. And then distal pole fractures, usually just a cast. The last thing about this is scaphoid fractures can be frustrating. It can take a really long time to heal. Sometimes it takes a year or longer. So I've had kids that have had to sit out full seasons waiting for it to heal, can be very frustrating. So be forewarned, this is not always a quick, easy fracture to go through. Thank you very much.